My name is Dr. Nancy Okinda. I am the Program Director for the Pathology Residency Program, and today I'm going to talk to you about the two programs we offer. The first one is Anatomic Pathology, and then shortly after that we shall look at Clinical Pathology. So for the Anatomic Pathology Residency Program, we have a number of goals and objectives that we hope to attain during the training. One of them is to provide supervised quality teaching in surgical pathology, cytopathology, autopsy, and forensic pathology. Number two, we aim to provide knowledge and technical skills to help residents to recognize, interpret, and explain pathological processes in the clinical practice of anatomic pathology. We also involve our trainees in quality assurance processes, both internal and external quality control, and they also take part in the accreditation programs within the Department of Pathology. Number four, we allow residents or enable residents to take responsibility for their continuing professional development by maintaining scholarly and professional attributes throughout their training. We also aim to produce pathologists who are competent in performing outpatient procedures, for example, the FNA. We involve senior residents and encourage them to teach junior residents to develop their teaching and leadership qualities and skills. We also encourage our residents to develop their full potential to become consultant pathologists who will be able to effectively manage and direct pathology laboratories within the country and the region. And finally, we prepare our residents to be lifelong members of the anatomic pathology profession and also to be recognized as specialists by the Medical and Dentist Board of Kenya. The Anatomic Pathology Residency program is a 4-year program that is geared towards enabling residents to acquire skills in consultative functions, professional knowledge, managerial functions, education, and research. Our residents also benefit because we have an integrated department, so they get exposure to the clinical pathology curriculum as well, and also to laboratory medicine. And also, there is also an additional benefit because our laboratory is a high volume private laboratory, and therefore the residents will be exposed to a full spectrum of basic cases and specimens, and also complex specialty cases. The Anatomic Pathology Residency Program focuses on 6 main areas of competency, namely patient care, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, and finally, professionalism. Our program has 2 clear components. We have the MED Part 1, whereby the residents will cover common core rotations. This is also the time they get exposure to the clinical pathology subspecialties or disciplines, and also they cover basic anatomic pathology training. Then after 2 years, they sit their Part 1 examination, and if they pass this examination, they move on to the MED Part 2 component, which covers in-depth surgical pathology, cytopathology, forensic and autopsy pathology. During this during this part, they are also required to complete a dissertation and pass it before they are allowed to sit their Part 2 exit examination in their 4th year. The program is delivered in a manner to allow the resident to develop adult learning skills and also to be a lifelong learner. So the residents are encouraged to direct their own learning, self-directed learning, through a case-based or a problem-based approach. And this with the ultimate aim of making our trainees lifelong learners. The program has certain expectations. We expect our residents to develop an understanding of basic pathological processes and relate this to morphological abnormalities. We expect the resident to acquire skills needed to interpret lab data and make clinical pathological correlations. The resident develops communication skills, and they're expected to communicate effectively and share their expertise with peers and colleagues. They acquire knowledge and experience in lab management. They acquire leadership roles in education, especially of other physicians and allied health professionals, like the laboratory technologists. It's a 4-year full-time study program, but the residents are allowed a maximum of 6 years to complete the program. During their training, the residents are assessed and evaluated using various tools. We have the formative assessment program and the summative assessment program. So for the formative assessment program, we use various tools to assess residents during their training, during the whole course duration of their training. It's an ongoing form of assessment, and we use the work-based assessment tools to assess various competencies throughout the training program or duration. And as I had earlier mentioned, they will have summative examinations at the end of their 2nd year of training as Part 1 examination, and at the end of their 4th year of training as Part 2 examination. Thank you.